Good morning, good afternoon, or good evening to our listeners, wherever you are listening to us from around the globe. Welcome back to Bassett 2025 podcast, and I'm here broadcasting from the lovely city Alexandria for the second version of the Bassett. I'm Professor Hossam Gazi, the Bassett president, and I'm Professor of Medicine and Interventional Thyroidologist. Today it's my own pleasure to introduce my friend from Brazil. He's one of the pioneers and one of the beginners to introduce such method about the thermal ablation for thyroid nodules in Latin America and Brazil. Dr. Rafael De Sico from Brazil. Welcome to us in Egypt and second country. Welcome to Bassett 2025.
Thank you, Professor Gazi. It's a pleasure and it's an honor to be here in Egypt with you and others, distinguished guests, and talk about radiofrequency and microwave ablation and other thermal ablations.
Thank you for joining
thyroid.
us. Okay, Dr. Rafael, let's start by giving our audience a broad view about how do you describe the current landscape of thyroid thermal ablation across the Latin American. We heard experience from one of professors from Asia. We heard experience from our colleagues in all the Arab countries in Africa. We heard experience from Asia and from Europe. But this is the first time we would like to hear about the current landscape of thermal ablation in Brazil and the Latin America.
Well, it's growing. Latin America training and the use of ablation for thyroid is growing. It's still behind Asia, still behind Europe and America, but it's evolving rapidly. Mm-hmm. So Brazil is leading the way.
Yes.
We have more cases. But after Brazil, we have Argentina, we have Colombia, and we have Mexico, that are countries that are evolving as well, radiofrequency and microwave ablation for thyroid.
Yes.
So we have a long way to go, but things are evolving rapidly, and I think we're going to get there. Things are moving, momentum is now.
Yes. Okay, regarding the patient perception about the thyroid ablation, in comparison to traditional surgery, a lot of patients here in Arab countries and Egypt, once they are heard that there is a surgery, they become panic and they hate the surgery and they can't pay anything regarding to save them from surgery. In other countries, the patients have no problem with the surgery, and in the contrast, they in fact love surgery and say that this is a cure for any problem, and they dislike the medical treatment. I want to know, how is the situation in Brazil and Latin countries? What is the perception of patients regarding the thermal ablation of thyroid nodules in comparison to traditional surgery?
Well, at first the patients were skeptical.
Yes.
So if you show them a procedure with no surgery, no scars, no surgery at all, they keep, is that real? Does it work? They kept skeptical.
Yes.
But in Brazil we have, and Latin America as well, we have a lot of aesthetical concerns. So the patients don't want the scar, don't want to take remedies, don't take medications for thyroid. And I think now the main reason for them to embrace the thermal ablation is the lack of need of medications.
Yes.
They hate to take pills all day for the rest of their lives. The main reason, not to avoid surgery, they don't care much about the surgery, they care about the medications.
Yes. Okay, as you said just previously, that it is introduced in Brazil and it is growing, and Argentina and Mexico and Colombia and so on. I want from you, and as an expert in the field of thyroid intervention and thyroid ablation, I want from you advices for the young doctors that would like to enter this career, either endocrinologists, radiologists, surgeon, nuclear medicine, physicians, whatever their specialty. They heard about the ablation, they're interested, they attend a lot of conferences like our conference. So a lot of them want to join the club of ablation. What's your advice from an expert like you for the young doctors who have no idea about how to start?
Yeah, they should start with training.
Yes.
They should look for a training facility. We have a lot of training facilities around the world. We have in Taiwan, we have in Korea, we have in Brazil. I have a training facility alongside with my good friend Erivelto Volpi. We have a training facility in São Paulo. And you should train not to do the procedure, but you should train how to select the correct patient for start. So you should start small, you should start with smaller
Easy
nodules,
cases.
easy, yeah. And you should train how to select well your patients. For endocrinologists, I gave my lecture today about the how to start your cases. You have to start knowing how to do the ultrasound. If you don't
is very
master,
important, yes.
yeah, you should master ultrasound. Sometimes we have a lot of experts in thyroid ablation who are radiologists. For them, ultrasound is
Easy.
nonsense. It's easy. But for me as a surgeon, and for
And
you
me,
as an
endocrinologist.
endocrinologist,
Yes.
it's not that easy. It's not that straightforward. So we have to practice. We have to do our own ultrasound in our clinics. Get used to ultrasound. Get used to fine needle aspiration biopsy, the technique, and when you master it, you are able to start training thermoablation. And another thing that I say, you have to have one more experienced person by your side.
Yes.
In your first cases, you should have one proctor, one guy who or doctor who trains guide you,
Support you.
support you in the difficult cases and the tough cases.
Especially at least psychological support.
Yeah,
like
sure.
surgery.
Yeah, it's like surgery. It's a
Okay, regarding the training programs in Latin America, is it evolving also like the thermal ablation, or it is you see that it is a stationary and the number is stationary or 1 or 2 activities per year? Do you, and for example, 3 years ago, is the numbers of activities and numbers of conference that interested in thermal ablation, is it the same number or the same interest now, or it is increased?
No, it's increased a lot. If you see 3 years or 4 years ago, we didn't have in Brazil any training facilities on thermal ablation, and we have 2 big facilities in thermal ablation in São Paulo, other smaller ones in other parts of the country, but we see that things are evolving and growing fast. So we have a huge problem in Brazil because we have 2 systems, healthcare systems, one public system and one private. In both, we don't have coverage for
Same here.
thermal ablation. So that's a problem. In my hospital that has public patients, we have done thermal ablation because of publications and studies, clinical studies.
Yes.
We're performing clinical studies, so patients
You have
can
fund
have
for
access.
this.
Yeah,
Yes.
I have funding for this. In private, we can have thermal ablation, but has a lot of struggle with the coverage and so on. So doctors still are. Things are not evolving that it should be, but I think it's growing. If you see 3 years back then, I think everything is growing fast.
Okay. Before we wrap up, Dr. Rafael, what excites you mostly about the future of thyroid ablation in Latin America? For example, usage of thermal ablation in parathyroid, in cancer, and lymph node metastasis, and other things like other than thyroid, parotid, for example, or whatever. How do you see the future of the thermal ablation generally and in Latin America, especially in the next 5 to 10 years?
Oh, I think a lot has to evolve. We got to get better at thyroid. We have to have more surgeons and more endocrinologists doing it. So we have to evolve thyroid first. But there's a lot of good applications for ablation, thermal ablation. For example, for parotid tumors. We have a lot of parotid tumors that are at risk for facial paralysis. If we can do a minor procedure with local anesthesia, easy to do, with good results, why not?
Yes.
So hyperparathyroidism, I think it's a good option as well. I have some concerns about secondary hyperparathyroidism, but new papers are showing good and better results that we used to have. So I think it's going to be a good thing. For metastasis and recurrence, I think the thermal ablation has its role itself, and I think there's more to evolve in a lot of other parts of head and neck oncology and head and neck surgery.
Dr. Rafael, you are most welcome to Egypt and most welcome for BASID. Thank you for joining us for this podcast with us. And now it is clear that thermal ablation is a worldwide recognized effective treatment for thyroid problems. Stay tuned with us in another podcast for Voices of BASID 2025. And there is a lot of international distinguished guests coming from outside Egypt to visit here in the PASIT 2025. Stay tuned for the next podcast. Thank you.
Thank you.